Okay, scanning the room.
Hi, my name is Jocelyn Imbernon. I'm an AD student at Williston State College, and today I'm going to be transfusing blood products for my skills video. So to begin, I'm in my med room and I'm going to gather my supplies as well as review my healthcare provider orders. He ordered to transfuse 2 units of packed red blood cells now, as well as an H&H to be drawn by lab 1 hour after the completion of the transfusion. I'm going to now review the lab results. The ABO test result was B negative, and her RH factor is also negative. So I'm going to go ahead and enter my client's room to visit with her before obtaining the blood product from the blood bank. So knock knock. Hi Samantha, my name is Jocelyn. I'm going to be your nurse today. Can I just have you confirm your name and date of birth? Samantha Lewis, 6/10 of 1975. Do you have any allergies? Yes to codeine. Awesome, you do have that on here. We're not doing anything with codeine today, and you do, just confirming that she does have a blood band on. So, Samantha, it looks like the doctor ordered for you to have a blood transfusion. Did he already come in and talk to you about this procedure? Yes, he did. Awesome. Do you have any questions? No questions. Okay, so I just have a couple forms I need you to sign here. This first one is just information about receiving a blood transfusion. This is pretty much what the doctor covered with you. And I need you to sign an informed consent that you're consenting that we do give you this blood transfusion. And this third paper is just saying that you did receive the information sheet as well as another consent to the blood transfusion. So Samantha went ahead and signed all of these for me. I'm going to go ahead and set these aside so I can put these in her chart. So Samantha, one thing I did want to talk to you about is sometimes when people do have blood transfusions, they can have reactions to the transfusions. So a couple of signs and symptoms I need you to inform me right away about if you do experience them is back pain, feeling warm, chills, itchy, anything like that. I need to know promptly so I can go ahead and stop the infusion. Do you have any questions? No questions. Okay, so to begin, I'm going to go ahead and provide privacy, perform hand hygiene, and put a pair of gloves on, so I can just assess my client's established IV here. So it does look like she has an 18 gauge catheter in, which is appropriate for blood transfusion. I don't see any signs of infiltration or phlebitis. When I palpate around the area, my client isn't complaining of any tenderness. So I'm going to go ahead and flush my saline lock just to confirm patency. I'm going to aspirate for blood flow. And I do see blood flow back into the line, not into my syringe. And then I'm going to go ahead and flush. I am confirming that it is patent. Next, I'm going to go ahead and get a full set of vital signs on my client for a baseline before I go and get my blood. So I've gotten my baseline vital signs. I'm going to go ahead and make sure to document those. Okay, Samantha, if you don't have any more questions, I'm going to go ahead and go to the blood bank to get that blood. No questions? Perfect. So I have new gloves on. I'm now in the blood bank and I'm getting my blood. I'm going to cross-confirm all of this information with a tech. So it looks like here, this is for Samantha Lewis. Date of birth 6/10/1975, blood band ID AFN 3889, donor ID 120708. It looks like the date sample was drawn on 11/1 of 20. Her cross-match date was 11/16. Cross-match expires 11/30, confirming that it is compatible. Yes, it is compatible, so that is good. I'm going to go ahead and head to my client's room now. I am noting that the blood doesn't look like it is clotting. It's not expired. Everything looks good, so I can go ahead and infuse this to my client. So now I'm in my room and I've grabbed a second nurse and we're going to go ahead and confirm this for a second time. So Samantha Lewis, date of birth 6/10/75, blood band ID AFN 3889. Just going to confirm that. AFN 3889. Perfect. Donor ID 120708. Sample was drawn 11/1 of 20, cross-match date 11/16 of 20, and it expires on 11/30 of 20 for a second time confirming compatibility. So I'm going to go ahead and set this at my client's bedside, and now I'm going to go ahead and prime my blood tubing. So once again, hand hygiene, fresh gloves. I'm going to close all of my clamps on my blood tubing here. And I'm going to spike my bag of normal saline. Once that is spiked, I'm going to go ahead and hang it. I know that blood products are only compatible with normal saline, and this is normal saline. So I'm now going to unclamp this, making sure that's still clamped, and filling my filter chamber. Here. Now I'm going to go ahead and keep this end of the line sterile as well as the cap. I'm just going to go ahead and prime this line. So I need to be able to recap it. I'm going to open that up, getting all the air out. Okay. I'll go ahead and recap this. Okay. Now I'm going to go ahead and confirm my blood for the third time, just by myself at the bedside. So this is for Samantha Lewis. Date of birth is 6/10/1975. Blood band ID is AFN 3889. AFN 3889. Donor ID 120708. 120708. Looks like the sample was drawn on 11/1. Cross-match date 11/16. Expires 11/30. Once again, this blood is compatible with my client, and my client has no further questions, so I'm going to go ahead and hang my blood product. So I'm going to make sure that my clamps are all closed. Going to spike my blood. Hanging that here. Okay. And I've confirmed once again that the normal saline is closed. I'm going to go ahead and open my blood here. And then open this clamp down here, keeping this sterile. I'm going to make sure that I'm extremely careful not to lose any of the blood product. I just want to prime the normal saline out of the line best I can. So that is good. I'm going to go ahead and put the cap back on this just so I can clean my client's saline off once again. Unclamp that. All right, so I know that since this is a manual line, this needs to, the infusion needs to start out at 5 mils a minute, or 5 mils, yeah. So then that's about 15 to 20 drops per minute. So I'm gonna go ahead and make sure my drops are initiated at the correct this open. There. Okay, I don't know. Oh, probably because it's connected to the arm, it's acting like that. Normal saline clamp is closed, blood clamp is open, as well as the lower clamp is open. So this should be infusing properly. I think it's because it's connected to that arm now. But I'm gonna go ahead, since I initiated the transfusion, I'm gonna get a start set of vitals. I'm gonna remain with my client for the first 15 minutes, just making sure that they tolerate the transfusion well, watching for those signs and symptoms that I described to my client earlier. If she's tolerating it well after 15 minutes and I get the set of vitals, I'm gonna go ahead and up the transfusion to 170 mils an hour, making sure that they tolerate that as well. And my transfusion is complete now, so I'm gonna go ahead and perform. I'm going to stop the transfusion and discard all of my blood tubing. So I'm going to go ahead and close all of the clamps here. And I'm going to go ahead, I'm going to close my blood clamp, open my normal saline clamp, so I can go ahead and flush the rest of the blood that is in my line into my client, making sure that they did receive the full transfusion. And once that is complete, then I can go ahead and take all of this off here. So I can discard all of my tubing into a biohazard bag. I'm gonna go ahead and record the stop time as well as get a stop set of vitals. The stop time, I'm gonna go ahead and call the lab and let them know when they need to come and draw the H&H, which is 1 hour after the stop time. Checking on my client, making sure they have no questions, making sure that they feel okay. And then I'm gonna go ahead and document everything. I'm gonna document the solution type and amount, as well as the blood type and amount, how my client tolerated it, all my vital signs, the unit numbers, confirming, also documenting that my client signed all the forms that she needed to, as well as the stop sign or stop time, and that is it.